Good morning. My name is Rodney Breau. I'm a cancer surgeon here in Ottawa, and I'm also the chair of the Canadian Urological Association Clinical Practice Guidelines Committee. I'm here today to discuss a very important issue, and I'm joined by my colleague, Dr. Catriona Hippman, to highlight the crucial importance of having content experts in clinical practice screening guidelines. As a bit of background, prostate cancer is a very common disease, and unfortunately many men die from prostate cancer metastatic disease. Prevention of cancer is obviously our dream, but that is not the current reality, so our best hope is for early detection to try and relieve suffering. Men generally do not have symptoms of prostate cancer, so if we did not have any methods of screening, we would be frequently finding this disease when cure is not possible. National screening guidelines are essential to determine which Canadians would benefit from screening and also how to effectively screen for this disease. In Canada, thankfully, we have a task force for preventive health care. This group is an independent, federally appointed body responsible for setting national screening guidelines. But it may be surprising to many Canadians, and in fact to many of our colleague physicians, that content experts are purposely excluded from these guideline panels. This disconnect has often produced guidelines that do not make sense to many physicians and patients. In March, over widespread concern from the healthcare community about the task force, the Minister of Health appointed an expert review panel. Unfortunately and inexplicitly, the review has recommended against giving specialists a seat at the table, meaning that experts would not have meaningful input into guidelines. This was shocking news to us, as the review essentially preserves the old task force methods, and it risks producing similar guidelines that are not based on current healthcare realities. Essentially, the expert review recommended inviting opinions from subject matter experts, but really there was no mandate to take these opinions and recommendations seriously. The lack of common sense guidelines is apparent to me because I am frequently asked by family doctor colleagues and other primary care doctors about how to best screen their patients for prostate cancer. If cancer patients and cancer experts are purposely excluded from national guideline development, Canadians and our medical community are underserved. Now, the main argument against having experts on guideline panels is that we may introduce biases into guideline development. And certainly bias is an important thing to mitigate, but excluding experts is not a good way to do this. We would recommend that biases are mitigated through transparency, diverse guideline panels, peer review, and robust conflict of interest policies. Simply removing experts does not eliminate bias, it just eliminates content expertise. At its core, this issue is about early detection and saving men's lives. Excluding subject matter experts risks producing recommendations that do not make sense to physicians and do not make sense to patients. They will be less nuanced, and in short, Canadians deserve better than this. Now with that, I would like to turn our attention to my colleague, Dr. Hippman, who will discuss why this issue also pertains to mental health and perinatal care. Thank you.
Thank you so much, Dr. Breau. As mentioned, my name is Dr. Catriona Hippman. I am a postdoctoral research fellow with the BC Reproductive Mental Health Care Program and Simon Fraser University, and an adjunct professor with the University of British Columbia Department of Obstetrics and Gynaecology. Today, we are calling for meaningful inclusion of subject matter experts in the development of Canadian preventive health care guidelines. This matters not only in cancer, but also in mental health, in reproductive health, and many other areas where prevention and early detection can change lives. Let me give you a concrete example. In 2022, the Canadian Task Force on Preventive Health Care recommended against universal standardized screening for perinatal depression. This decision runs counter to guidelines both in Canada and internationally, and the consequences are serious. When perinatal depression is not detected early, families often reach a crisis point. In research we published this month, we found that over 150 women and birthing people are hospitalized every year in BC alone for postpartum mental illness. One mother who shared her story with us said, "I would say the hospitalization process was 10 times as traumatic as the postpartum psychosis itself." This is not prevention, it's crisis response. We can and must do better. Even within the task force's own process, the evidence pointed in the other direction. Their systematic review identified a randomized controlled trial showing that universal standardized screening led to better maternal mental health outcomes at 6 months postpartum. Their own patient preferences studies showed participants overwhelmingly wanted screening, describing potential harms as trivial compared to the benefits. Yet, speculative harms were prioritized over documented benefits, expert input, and patient voices. And this example highlights why subject matter experts must be included as voting members of guideline development panels. Without their input, critical nuances are missed and patients suffer the consequences. Primary care in Canada is increasingly team-based. The guideline process should reflect that reality. Canadians deserve preventive health guidelines that are rigorous, practical, and responsive to patient needs. To achieve that, subject matter experts must be included in the development of national guidelines. Whether it's cancer, perinatal depression, or any other health issue, the inclusion of expertise will help ensure guidelines reflect the best evidence, real-world experience, and the voices of patients and families. This is how we can create guidelines that truly serve Canadians, guidelines that save lives, reduce suffering, and build a healthier future. Thank you very much.
Thank you. We do not have any questions at the moment. Nous n'avons pas de questions pour le moment. Is there something you would like to add to your statement?
No, thanks.
Thank you. This concludes the press conference. Merci. Ça conclut cette conférence.